Whether you have pain in your back or joints, surgery may not be the answer. Instead of the dangers involved in cutting out tissue, consider healing and rejuvenating the area with stem cells, platelet-rich plasma, or prolotherapy. The treatments that are available to professional athletes are now available for you. Watch the videos at jointrehab.com or call the Darrow Wellness Institute at 800-300-9300. 800-300-9300. That's 800-300-9300.
Welcome back to Living Pain Free with Dr. Marc Darrow. I'm your host, Nita Valens, and we're taking your calls about your orthopedic or musculoskeletal pain right here, right now in the studio at 866-870-5752. And right now we have Helen waiting. And stand by, Helen. Did you want to say something, Dr. Darrow, before we go back to Helen?
Yeah, Helen, hang with me, please. We just finished up the first half-hour break, and I want to let all you new listeners know what's going on here. The show, Living Pain Free, is all about using regenerative medicine instead of surgery for your musculoskeletal complaints. We love the surgeons, but we don't like all of the surgeries that are being done. There are things like meniscal tears, rotator cuff tears, labral tears, tendonitis, and all of that that often gets operated on, herniated discs, for back pain, neck pain, people who have foraminal stenosis, who end up getting rotor-rooter surgeries that don't need it, infusions. Sometimes they need it, but unfortunately I see many people who get these surgeries that get no better and didn't really need them in the beginning anyway. So I have a little bit of a jaundiced eye. I apologize for my attitude about it, but it's well grounded. I get way too many people that have come in with failed surgeries, back surgeries, knee surgeries, shoulder surgeries, whatnot. And then very often we can heal them using regenerative medicine, which is platelets called PRP, platelet-rich plasma, and stem cells. So these are things that can help regrow tissue. And Helen, I wanted to talk to you now, but I want to do a little talking myself. I've listened to what you had to say. You've had 32 years of pain all over your body called fibromyalgia, with trigger points and all that. And, excuse me, there's only one cure I've ever seen for that. And I've dealt with endless patients over the last 20-some years that have it. And that is an alkaline diet. So I want you to write that down, Helen, and go to the internet and look up what an alkaline diet is. I'm not here to talk about diet, but in this particular case, that is the only thing I have ever seen that works. When you alkalinize the body, you reduce the amount of acid, and there are acids and proteins, amino acids. So we have to balance out the diet better, and sometimes we have to take alkalinizing agents. There are also test strips that you can use to urinate on to show you if your body is alkaline or acid. So I'm going to leave that up to you. If you want to email me, go to my website at www.lastemcells.com, and I can talk to you more specifically about the diet. But for right now, that's the answer I have for you. The areas that are your real problem areas all around your body, because you're sore all over, you've got arthritis in your neck and all that, we can probably help you with by injecting platelets or stem cells. But you're going to have to come in the office. To get into the office, the phone number there to see me is 800-300-9300. I'll repeat it for you, Helen. It's 800-300-9300. Okay?
Okay.
Thank you for your call, Helen. We appreciate you. And our number, line's open for you right now, but the time is flying by. Please call us right here in the studio at 866-870-5752. That's 866-870-5752. And check out the website at www.lastemcells.com. And we have Gary in Thousand Oaks.
Wait, Nita, are you ready to laugh?
I'm ready.
Go get ready.
I'm
Gary, this is Dr. Marc Darrow. How are you today?
Yes, thank you for taking my call. About 14 ago, I went out and ran too much for about 40 minutes and severely injured right biceps femoris. The pain was just terrible the next morning when I just stood up.
Oh, I'm sorry to hear that. At least it wasn't the wrong biceps femoris.
Well,
Nita.
I had ultrasound physical therapy treatments 3 days for 12 weeks, and that helped a lot.
Good.
But the physical...
So I take it that you had this happened to you about 3 months ago or so?
Well, yeah, the treatments ended about 2 weeks ago.
Okay, but your injury was 3 months ago.
Well, the injury was about 3.5 months ago, and the physical therapy treatments ended about 2 weeks ago. And about every 2 weeks, for the last 6 weeks, I would go to the gym and just try and lift 20 pounds on the hamstring curl, and even that was very sore. So I just can't get past the point where I can even lift 20 pounds without soreness.
I am so sorry for that, and I think there's a cure.
Well, do you think stem cells could get me over this hump?
I do,
if I had
but I have to touch you first to make sure. I have to touch the area, Gary.
On the machine?
Gary, I have to touch the area and examine it to let you know what's up.
I understand that. That's what you said 5,000 times. I listened to your show.
Oh, good. Thank you so much.
Yeah.
Yeah.
Okay, so you think that the stem cells would get me over this hump where I could even do light work on the hand?
I think you'll be able to run a marathon afterwards and play the violin.
Well,
Nita,
do you play the violin already?
No.
It's kind of a strange situation, Doctor, because I've been able to get on the Stairmaster and work out on level 7 through 9 for 50 minutes, but every time I try and get on the treadmill and walk fast on an incline, the walking irritates it and just injures it again.
Well, that makes total sense. I mean, it's a different part of the muscle that's being used. So we have to isolate the part of the muscle that is irritated. It may be torn. It may be stretched. I don't know what it is. We'll look with our ultrasound.
That's the problem. I isolate it on the hamstring curl. That's when it hurts, and I just can't get past that hump, even with physical therapy treatments.
Okay. Well, there's one way that you can figure it out. Come on in. We'll look with the ultrasound and see what's going on in there. You haven't had a scan done?
I've just had physical therapy ultrasound treatments 3 days a week for 3 months that ended about 2 weeks ago.
Yeah, I know your story.
A lot, in addition to a lot of stretching that I do 2 or 3 times a day, but I just can't get on the hamstring curl machine and exercise it even with light weights. Okay.
So I would say, Gary, the best thing for you to do is come on in the office. I'm going to give you the phone number. You can call right now. There are people by the phones. It's 800-300-9300, 800-300-9300. And you can go to my website and watch videos of me doing these procedures, www.lastemcells.com. You can also email me there. It's www.lastemcells.com. And I'd love to see you. I will touch the area. You'll show me where it is. And then we'll look with my ultrasound inside. The type of ultrasound you had is a treatment. The type of ultrasound I have is diagnostic. We look inside. It's like a camera that goes inside the body. It's not really like that, but it looks like that. And it's a live scan. We have it immediately available. As soon as you get in the office, I could take a quick peek and let you know what's going on. Okay? So God bless you, Gary. Thank you so much for listening to the show, and I'm looking forward to seeing you.
Okay, and guess what? We still have lines open for you and a little bit of time left. 866-870-5752 right here in the studio. You can speak directly with Dr. Darrow. You can also check out the website at www.lastemcells.com. You can email Dr. Darrow off of every page on the site and also watch him performing the treatments on videos. Very exciting stuff. If you're visual, check it out. And when you phone the program today, you also get Dr. Darrow's latest book for free, Stem Cell and Platelet Therapy, subtitled Regenerate, Don't Operate. It has 264 scientific studies, and the foreword was written by Suzanne Summers. And you also talk a little bit about hair growth in that book. And do you want to say a word about that for a minute?
Yeah, we have a chapter on using platelets and stem cells to regrow hair on the head. It's not going to work on Dr. Phil, but if your hair is thinning, we can check. Finally, I get Nita. If your hair is thinning, we can check you out. I like to get the hormones checked because often it's a hormone imbalance. In men, it might be a high dihydrotestosterone. In women, it can be an imbalance in the hormones, low iron, low thyroid, things like that. So we would check you out. And the other thing is we do what's called the vampire facelift. You'll never forget that. It's a non-surgical facelift where we just inject the face with stem cells or platelets and regrow the collagen in the face and bring you to a younger state of being. It's a wonderful thing to do.
Excellent. Well,
may I take a question here?
Yes, you may.
Okay. This one's a little complex, so bear with me. It's an email that came in Friday, and it says, I'm interested in a consultation regarding thoracic back pain. That's the middle of the back. So the cervical is the neck area, and the lumbar is the low back, and the thoracic is the middle. And resulting from spinal infarct. So that's a little unusual. Also use of PRP and stem cells alternative to knee replacement. So this person's got a lot of stuff going on. May also get a copy of my book. Yes, you may. So that's already been sent out to you. And then I sent an email back, and then I got this response. Hello, doctor. Thank you for your response. My back issue began in 2016 after open heart surgery to replace my mitral valve. With exception of valve, I had no serious health issues, good cholesterol, no obesity, low blood pressure, not diabetic. But during surgery, after valve successfully replaced, I had aortic dissection, and immediate repair was performed. Aftermath, weakness in legs, neuropathy in feet. Left leg weak and right sensitive to cold and hot. I can walk, but if walking too long, I get pain in my thoracic back, right around the bra strap area. By the time early evening approaches, I need to take ice and tramadol, which is a painkiller. I was active prior to limitation, and that's a problem now. Pain is not constant, only after walking. If a mile, I need to take a brief rest a couple of times. I'm told T7 and 8, those are the thoracic 7th and 8th vertebrae, is where the damaged tissue is. Tried PT, acupuncture, Botox, radio frequency ablation, and PRP and stem cell once to the specific back area. Truly believe stem cell innervation is the most promising. Still hoping the advancement of this area of science will be a welcoming solution to all stroke patients. And then she switches to arthritis in left knee. Played tennis and skied when younger, broke 2 legs in auto accident at age 17. As an adult player, golf, knee is wearing thin. Lubricant injections, that's called hyaluronic acid, have helped last couple of years but wearing off now. This too limits my walking. So let me just deal with this first thing. So this patient had a required surgery on the heart, and as an aftermath of the surgery, there was a problem with the aorta, which they fixed, but there was an infarct to the thoracic area, and part of the spinal cord was damaged. Infarct means lack of blood supply, which can happen. Surgery is not for the weak at heart, so to speak. You know, even simple surgeries can really hurt people. I'm not saying you shouldn't get them, because a lot of these surgeries you do have to get. And I had one. I had something weird called a pheochromocytoma. It's a long word, which could have killed me if I hadn't taken it out. And it produced adrenaline. So I had that taken out. And that's a very dangerous surgery, but I opted to do it to get rid of it. So there are surgeries we do need to do. I'm not putting surgery down, But I do put down these orthopedic surgeries that are done when they don't need to be done, when regenerative medicine can be used instead, which is just, taking your blood or taking your bone marrow and injecting it. Simple procedures. So this person with thoracic pain, there is a very good chance I can help by injecting around the ligaments in that thoracic back area. I'd have to touch the area first and see where the pain is coming from. But that is, part of the exam is touching the patient. If you go to a doctor in orthopedics and he doesn't touch you, go to a different doctor. Don't let him rely on your MRI or X-rays. It's good to have them to see what's going on, but they are not the telltale sign of where your pain is coming from. They don't always show you where the pain is being generated from. We need to find the pain generator with our examination. Now, the arthritis issue this person has in their left knee, that's something that we do all day long. We do spine all day long also. And I inject the entire body. This person had lubricant injections, which is really hyaluronic acid. It's a lubricant. It really, it can help some people sometime, but it doesn't fix the area like regenerative medicine does. It doesn't grow tissue. And there are actually studies now that show that if you get these hyaluronic acid injections, there is more joint destruction down the road. So be careful about those too. Also, sometimes if the doctor misses the joint and puts this stuff into the soft tissue, the person has to have an incision and drainage to clean it out. It looks like an infection, so be very careful about that too. Make sure if your doctor is injecting your knees or your hips or your shoulders that he's using an ultrasound to look inside and guide the needle. We have studies that show if they don't, they're missing the joint at least 1/3 of the time. So be careful. Get a doctor that uses an ultrasound if you're going to get injections. All right, Nita, anything
Sounds
for you to
good.
say?
I do, thank you. I want to just give the phone number out because we do have a little bit of time left and have lines open for you at 866-870-5752 right here in the studio. You can speak directly with Dr. Darrow about your musculoskeletal pain. In case you're just joining us, that means any kind of back pain, neck pain, knee pain, hip pain, arthritis pain, and all kinds of other things just to give you a sense of what we're talking about here. You get a free book by Dr. Darrow, his latest, when you phone the program today. It's called Stem Cell and Platelet Therapy, Regenerate, Don't Operate. It has 264 scientific studies, and also check the website out at www.lastemcells.com. That's www.lastemcells.com, where you can email Dr. Darrow off of every page on the site, and you can see him performing the treatments on videos. And if you're a long-term listener and you've been listening for a while and you want to just call the office directly, you can call anytime, even right now. That number is 800-300-9300. That's 800-300-9300, and make an appointment, because you were just saying a few minutes ago, Dr. Darrow, you've gotten very, very busy again. So better to call sooner than later and get your appointment in. And again, our number right here in the studio for you to call right now is 866-870-5752. We are here Saturdays at 10 a.m. and also at 1 p.m. And what have you got in the realm of questions?
Endless questions, endless emails.
I knew you'd say that.
This one says failed ankle fusion. So that means that the ankle was fused and they didn't get better. Let's see what the person says.
Okay.
My ankle fusion surgery failed. I do not want to have more surgery, although the doctor thinks I should. I don't think it'll heal the next time. Is stem cell treatment an option? Will it work? What do you think? I'm in good health, only for the arthritis in my ankle. I'm 72 years old. Yeah, I treat a lot of people that have had ankle fusions that didn't work. I've had endless people that have ankle arthritis that I treat before the fusions, and ankles heal really well. I think it may be because blood pools in the area from gravity, It's the only way I can think about it. I'm not sure why, but ankles do heal usually quicker than other parts of the body. And the reason I think that is blood carries oxygen. The hemoglobin carries oxygen. Oxygen is really what heals. I know people don't think that's true, but if you've ever had, which I have had, I've had many patients that have had, let's say, diabetic foot ulcers, burns, things like that. I put them in an oxygen chamber, hyperbaric oxygen. They heal right up. People ready for amputations, they heal right up. So oxygen is the healing agent in the body. So yes, I do think that this person's ankle can be helped with stem cells or platelets. I have to look at it, touch it, see what's going on, and there's good hope. By the way, this is a disclaimer. The work I do is not magic, okay? It doesn't work on everybody. Nothing does. But at least it's a good shot at healing without surgery. And if you don't heal, you can still get surgery. If you get surgery, sometimes I can't help you afterwards. So surgery is invasive. What I do is not. Another question? You ready?
I think so.
Okay. Let's see. This one says elbow. Had elbow surgery when I was 12 years old and 44 now. The pain and mobility the last few years has become increasingly terrible. Wondering if your techniques could help. I do tons of elbows. Did both of my own with amazing success. I injected my own elbows about somewhere 15 to 20 years ago. Never had a problem since. I had lateral epicondylitis, which is called tennis elbow in both elbows, and I was a very strong advocate of playing tennis as many hours a day as I could, and blew out both my elbows, weightlifting and whatever. Injected them, got better. So yeah, I don't know what's going on with this person. They had surgery. I don't know if that was to repair the joint, the bone, or the tendons. So I have to examine this person and see if what I do can help them using platelets or stem cell injections. Usually we can help, not always. You got to come in, let me touch the area. If you do want to, the phone number of the office is 800-300-9300. If you want to watch videos of the work I do, go to my website, www.lastemcells.com.
Okay. Our number is 866-870-5752 right here in the studio. We have a bit of time left. Lines open for you. 866-870-5752. I didn't hear a knee problem today.
Knees. Okay, here's a knee question. Let's see. Injured right knee, MRI shows meniscus gone from root. That means separated. Kneecap with osteoarthritis and not tracking correctly. This is common. All this stuff is common. I see it every day, and most of the people get better. Not everybody. Who doesn't get better? Usually people don't get better if they go out and exercise the area too soon. Okay? And we had a call from Dan, who's one of my patients, earlier in the show, and he said he actually went out and got crutches. We don't ask people to do that after a knee injection, but he's very smart, and he stayed off of it. He's doing better already, and he was just injected 10 days ago. So you can't beat it up again. If you've been beating it up for years and then we inject you and you beat it up some more, don't think it's going to heal right away. It's going to take longer.
Okay.
Take it, Nita. It's all yours.
All right. Sally, please go to the website, www.lastemcells.com, or call next time earlier in the hour. And thank you, Alex. Thank you, Suzette. Thank you, Dr. Darrow. Grab a pen or a pencil and write down this important information coming your way. Listen to our pal on the Pet Show from 11 to 1 every Saturday, and we'll see you next time.
You've been listening to Living Pain-Free with Dr. Marc Darrow. Now that you've heard Dr. Darrow, you can schedule an appointment to talk with him in person by calling his office anytime at 800-300-9300. That's 800-300-9300. Or go online to lastemcells.com. Again, the website is lastemcells.com. Living Pain-Free with Dr. Marc Darrow is heard every Saturday at 10 a.m. and 1 p.m. here on AM 870 The Answer. Remember, to take the first step toward a pain-free life, schedule an appointment by calling 800-300-9300. That's 800-300-9300. Live long and pain-free. And thanks for joining us today.